3, 2, 1. Alright. Sorry. 3, 2, 1. Okay, then go.
Hello, I'm Dr. Vera and I'm a doctor with Doctor Anywhere. Today, we'll be addressing some common questions and debunking misconceptions around sexual health and around birth control. Let's start with the topic of sexual health. Is this a taboo topic in Singapore?
So yes, it's a taboo topic because growing up here, it's something that's a no-no. We don't talk about it. So my mom usually don't talk about all this kind of stuff. But I think in the recent years, it has been more open because internet and everything, it's more liberal. So have more conversations about this as well. Yeah.
What about you, Jackie?
I think there is a lot of difference from my time, I speak as if I'm very old. I'm quite old already. Yeah, so traditionally, back 20, 30 years ago, information was not widely accessible on the internet. And so, I would find a challenge getting information from people who would be in my circle, or the other option is having to ask people who have experience with taking birth control pills.
Yeah, and I think we're moving in the right step. Companies, for example, Doctor Anywhere, we do hope to improve awareness and provide informative content like this. So let's move on to some questions that you guys might have or would like to find out around sexual wellness and sexual health, birth control, etc.
I just was curious, when does sex drive decrease? At which age, or is there any other external factors that might affect? Yeah.
Okay, so there's no golden age, or maybe not so golden age, whereby sex drive starts to decrease. It can fluctuate in one's lifetime, whether it comes to periods of extreme stress, anything that dysregulates your hormones can cause reduction or increase in sex drive. Common periods where there may be such changes include during pregnancy, as I mentioned, periods of stress. Menopause is one of them. And yeah, there's really no age. Some people may say that birth control affects the sex drive. This is really not so much the case in the long run. Many people may have some changes in what they experience, but in general, once you have been taking it over several months, all this, it kind of stops in terms of the side effects.
How does BC actually work?
Okay, so taking oral contraceptives involves taking an external hormone. Okay, and basically how it does in a broad sense, in terms of preventing a pregnancy, would be firstly it prevents ovulation in the first place. So that's the main thing it does. The other ways in which it also helps to prevent an unwanted pregnancy would be it helps to thicken the mucus that we have in the cervix, and this really helps to stop sperm from moving through the cervix. Yeah, and the last way it helps to prevent pregnancy would be it thins the lining of the womb so that it's extremely difficult for any egg that is fertilized to be implanted.
So my question would be how safe are contraceptives? And my reason to ask is because I've noticed a lot on social media an increase of people who decided to stop taking contraceptives because it is deemed unnatural.
In general, it's safe. Yeah, in general, it's safe.
99.9% accurate.
Yeah. That's what they say, right?
Yeah. So it's safe. There are side effects associated with taking birth control, and majority of them mild. So some people may experience a little bit of bloatedness, they may experience a little bit of changes in their mood, maybe changes in the sex drive as we discussed earlier. And these tend to go off after you take it consistently for several months as your body gets used to taking this new medication. In the long run, of course, there are certain side effects, including you may have slightly increased risk of having blood clots form in parts of the body, in the legs, in the major blood vessels in the body. Other things will include just a very slightly increased risk of breast cancer that goes down actually after you stop taking the pill for about 5 years. It goes back to normal. Yeah, so these are just the minor side effects and nothing, assuming if you have a clean bill of health, nothing that we would used as advice against taking birth control. And when we talk about the benefits of taking birth control, firstly, preventing unwanted pregnancies. Of course, if you're not ready or you do not want a child, then that is a really good method. The other one would really be to regulate your hormones, regulate your menstrual cycles, and in certain instances, it can help to reduce the amount of blood loss every month. It can help to regulate the pain that you get from menstrual cramps. And there's always good and bad, pros and cons. When we talk about it in general, it's safe and in fact should really be considered by anyone of childbearing age who is not ready to have a child.
What is that window period where it's still safe or it's still effective? Because you have to take it at the same time every day, right? And if you were to fly at different time zones, it's very hard to keep track. So what's that safety period?
When we're talking about monthly birth control, it's taking it every 24 hours. Unfortunately for those, or maybe fortunately, those who get to fly a lot and travel overseas, it's a lot of fun, but it's a lot of hard work as well, having to set a reminder. And as I mentioned earlier, making it part of your routine to such that you would remember to take the pill at the same time every single day. So it's every 24 hours. And if you're flying across time zones, you need to do the hard work to calculate the hours. But if you're missing it by more than a day, of course, it really depends on the time frame. But the general advice would be if you need to have been taking the pill for 7 days consecutively for it to be considered effective. So if you have missed it by more than a day, then you need to, in the interim, make sure that you're using other methods of contraception. I hope all of you here today and all of you watching this, you guys have learned something from this session. Bye!